Parenthood should happen by choice and not by chance. The common reversible contraceptive options include the oral pills, intrauterine contraceptive devices or IUDs as we call them, the injectable contraceptive and the implant. Most women use the oral pills for spacing their pregnancy. Now these oral pills are hormonal, containing the estrogen and progesterone hormone. In the government setup, they are available as mala and tablets. There are various other formulations which are available with the local chemist, and they generally differ in the type of progesterone as well as the dose of the hormone. Now they are available as packs of 21 tablets or 28 tablets. The ones which have 21 tablets are generally all hormonal tablets, and the ones which have 28 tablets like this pack of Mala N would have 21 white tablets which are hormonal and the last row of brown tablets which are the iron tablets. Now you can start the new pack anytime between first 5 days of your period. You start with the white hormonal tablet, go row wise, and then you'll be taking the brown tablet when you will have the withdrawal bleed. Now, who are the women who can use the oral pills? Almost all age groups starting from the teenage girls to women up to 45 to 50 years can use the oral pills. Now, women who have just delivered and are breastfeeding their babies cannot take these oral pills for 6 months at least, because these pills decrease the quantity as well as the quality of milk. Then women who have heart disease, active liver disease, deep vein thrombosis, have migrainous headaches, again cannot use the oral pills. Women who have breast cancer should also not be using these oral pills. Now, these pills of course have contraceptive benefits, but we need to remember that they have many non-contraceptive benefits. The most important being that they regularize your periods. They even decrease the menstrual blood flow as well as decrease the menstrual cramps. Then these pills are also used to treat polycystic ovarian disease. They decrease the risk of benign disease of the breast like fibroadenoma breast. They also decrease ovarian as well as uterine cancer. The most common side effects which women can experience with these oral pills are some headaches, nausea, vomiting, acne, breast tenderness. But these side effects are reversible, and as soon as the woman stops taking these tablets, then these effects also go away. And another good thing about these pills is that the return to fertility once you stop these pills is immediate. Now the next oral pills which are available are non-hormonal and non-steroidal. उनमें ना estrogen hormone है, ना progesterone hormone है. They have a compound called centromin, and they are available as tablet chaya in government supply. Now the best part about these pills are that they are once a week pill. तो ये available होती हैं in a pack of 8 tablets. First 3 months you need to take 2 tablets in a week. That is, आप अपने first day of the period पे start करो. So if your first day is on a Sunday, so you take 1 tablet on Sunday and repeat the other tablet on Wednesday. If you start the pack on Monday, you repeat the tablet on Thursday. But 4th month onwards, you just need to take 1 tablet in a week. The common side effects which one can experience while taking these pills is that there might be slight irregular periods. The periods might become scanty, and at times they can also stop. But then again, these are just reversible. So as soon as you stop the tablet, all these side effects would go away. And the major advantage of these pills is that they can be started right after delivery, because क्योंकि इनमें हार्मोन नहीं है, so it does not affect the quality or the quantity of milk. Then another oral pill which is available is the emergency contraception. Now this is available by the name of Easy in government supply, but you can take it from the chemist with the name of morning after pill or eye pill. So what this is just a single tablet which is to be taken within 72 hours of unprotected intercourse. It is best if you take this within 24 hours, but not later than 72 hours. So this can protect against pregnancy. But the most important part to remember is that this is not an ongoing method of contraception. You can take it once, but that does not mean that you keep on taking this tablet whenever you have unprotected intercourse. You need to start a method of contraception which would be long lasting. You need to start another method of contraception. And this tablet can also be taken by women who cannot take the hormonal tablet, because this is a single tablet, so it doesn't really have any of the side effects. So even women who have contraindications to oral hormonal pills can take this tablet. Then there is a injectable contraceptive which contains the hormone medroxyprogesterone acetate. This is available in the government supply by the name of injection Antra. Now this injection contains 150 milligram of the hormone, and it is to be repeated every 3 months. The injection is given intramuscular, either in your upper arm or in your thigh. The most common side effects which are seen with this injection are basically irregular periods, or your periods get scanty, or they may totally stop. But then again, these side effects are totally reversible, and once you stop taking the injection, your periods would be coming back to normal. The advantages of having this injectable contraceptive is that you don't really need to take it daily. It is not something like an oral pill which needs to be taken daily. You take one shot and then you forget about the further contraception for the next 3 months. Then this injection can be taken by breastfeeding women also, but we generally start 6 weeks after delivery. This injection would also protect you against ovarian and endometrial cancer, and because it is decreasing your menstrual flow and menstrual cramps. So women who actually are having increased flow during periods, this injection is quite helpful in them. Another long-acting reversible contraceptives are the intrauterine contraceptive devices. Now, as the name suggests, these devices are put inside the uterine cavity. There are two most common non-hormonal IUCDs which are available. One is copper 380A, which is effective for 10 years, and the other is copper 375, which is effective for 5 years. So what actually are these devices? Basically, they have a plastic frame on which, as you can see, copper wire is wound. So they are put inside the uterine cavity. They fit snugly and prevent pregnancy from happening. Now, these devices can be put within 1 week of your period. They can be immediately put after delivery. Whether you have a normal delivery or you have a cesarean, IUCDs can be put immediately, and they can also be put immediately after an abortion. The only side effect which is common with these IUCDs are that for the first 2 or 3 months, you might experience slight increased bleeding, but by 3rd month, it gets back to a normal cycle. The advantages of IUCD are that because they do not contain any hormone, so there are no hormonal side effects seen with them. Then once you have the IUCD inserted, you can forget about further contraception for the next 5 to 10 years. And whenever you want your next baby, you can have the IUCD removed and fertility comes back almost immediately. The IUCD can also be used as an emergency contraceptive. If you get an IUCD inserted within 5 days of unprotected intercourse, then it acts as an emergency contraceptive, and then this can continue as ongoing contraception. There are also hormonal IUCDs which contain the hormone progesterone. These are generally effective for 5 years, and they are very helpful in women who have heavy or abnormal uterine bleeding. The next important option for a long-acting reversible contraceptive is the implant. Now, implant is a small flexible rod which is the size of a matchstick, and this is inserted under the skin of the upper arm using this disposable applicator. It is generally inserted in the non-dominant upper arm, meaning thereby if you are a right-handed woman, then this would be inserted in the upper arm of your left side. Now, an implant is effective for 3 years. The main side effects seen with the implant are again change in menstrual cycle with irregular or slight spotting happening for the first 2 to 3 months, but after that the cycles get back to be normal. The advantages of implant, of course, are many. It's long acting, so you have it inserted once and then you can forget about further contraception for next 3 years. The implant can be inserted right after delivery or abortion. So that means that if you've had a delivery today, you can have the implant inserted the same day, even before discharge from the hospital. Then this also protects against pelvic inflammatory diseases or genital infections, as we call them. Then an implant, once you have the implant removed, the return to fertility is not delayed at all and you can conceive even in the next cycle. So use contraception in your life till you're ready to have a child. If you like my video, please subscribe to my YouTube channel, Your Mom Docs.